Hi, I'm Dr. Sandy Chuan from the San Diego Fertility Center, and today I'll be doing an injection teaching session for you to help you learn more about the medications you'll be using in your upcoming IVF cycle. We understand that the thought of doing an injection for yourself is very daunting and certainly nerve-wracking for everyone. So hopefully by watching this video, you'll learn some helpful tips and practical information about how to utilize your medications and do your injections to make the process a little bit less daunting and help you feel more comfortable and more confident with the entire process. Part of the reason why we wanted to create this video is also so that you can have this as a tool, so before you start your injections, that you can always refer back to it if you need a refresher. I think that, it's one thing to learn the first time, but it's another when you're actually sitting down to do the injections. So I always encourage people to kind of refresh their memory and look over any instructions they have before they get started. I'm also going to include another tool for you here. I'm going to refer in the link below to the Freedom MedTeach website. You certainly could also just Google it, Freedom MedTeach. This is an excellent website that basically includes individual injection instructions for every fertility medication you can think of that you may be using during a fertility treatment process. So all you have to do is refer to your specific medication and you should be able to find the associated video. I think that the video that I'm going to be sharing with you here is going to be helpful in giving you practical tips and certainly be enough to teach you how to do the injections. But if you feel uncomfortable at all, please refer to the Freedom MedTeach website. Also, our staff members are always available to help you. If you have any questions at all, we can definitely address them and help you clarify anything that is confusing, even if it's on the evening of your injection. If you call the main line, you can always page through to a provider that can help to answer your questions. And so please don't hesitate to reach out if you need anything. Now, couple of things. I usually will remind patients to go ahead and pull out their treatment calendar and protocol before they start their injection, and any instructions that you may have received on the day of your visit for your baseline ultrasound. So when you have your IVF cycle planned out, one of the first visits and the most important visit is your baseline ultrasound to check to see if you can get started. We'll be doing an ultrasound and doing blood work, and usually on that day, you're going to get a call in the afternoon if anything doesn't look right and you're not able to get started and we need to postpone the cycle. But typically, patients are ready to go. If there's any dose adjustments, we'll usually also notify you. So please do check your voicemail and emails to make sure that you didn't get any updated information. But otherwise, the dose that's listed on your treatment calendar for the medications that you're prescribed should be accurate. So you want to double check that so that you know the exact dose that you should be on. Okay, so that's very important, and that's kind of preparation. And you also want to make sure that you have all of your other supplies. So I always tell patients, make sure that you received your sharps container, make sure that you have all your needles and alcohol swabs, everything just kind of laid out and ready for you to start mixing your medications. And I'll address that a little bit shortly in the video. But first of all, I am going to cover the most common medications that you're going to be using in an IVF cycle protocol. And so typically patients are going to be starting with two medications, and that would be Menopur and Gonal-F. Okay, Gonal-F is basically an FSH hormone. Gonal-F is the brand. And so there are different formulations of this particular medication. So in this video, I'm going to be covering mostly just the Gonal-F multi-dose 450 IU because this requires mixing, and it's very easy to use once you learn, but that does require a little bit of more work up front. So that's what this video is going to be focused on. However, I want you to know that Gonal-F also comes in a pen form, and this pen form is about 900 units in there, and it comes in already kind of pre-mixed liquid form, and you'll have to attach a needle and adjust the dose. And so I'm gonna include the link to the Freedom MedTeach video below, so that if you're using a Gonal-F pen, that's what you will want to watch. And then also another brand for FSH hormone basically is Follistim, and it works similar to the Gonal-F Pen, but again, I'll refer you to the Freedom MedTeach. At some point, I may probably make another video just focusing on how to use these two pens, but for now, please refer to the Freedom MedTeach injection instructions for these two, and it's very straightforward and easy as well. But the video will focus on this. Now, so those are the two medications that you'll be starting with first. Now, mid-cycle, patients, well, let me take a step back. There are times in certain treatment protocols where you will be doing one or the other of Menopur or Gonal-F. So if that is your protocol where you're not doing, Gonal-F, but you're just doing Menopur, then please, when you're watching this video, please just take into account the Menopur portion of the video. And so moving forward, I want to talk to you about a medication that we usually add during middle of the cycle to help suppress premature ovulation. And that medication is, the formal name is a GnRH antagonist, and that's quite a mouthful, but there's two brands for that particular medication. So one is called Cetrotide, and it comes in a box that looks like this, and then the other is called Ganirelix. And so you'll be prescribed one or the other. Part of that decision depends on your insurance coverage and maybe cost at the local pharmacy. So we'll always try to find the option that is the least expensive for the patients as much as possible, okay? So very commonly at our center, we're using Cetrotide. That's the most common. So this video is gonna focus on Cetrotide because, again, Cetrotide requires a little bit of mixing. Ganirelix is just a single dose. It's already pre-filled, so you just have to inject. So I'll refer you to a link below to the Freedom MedTeach instructions, but the video will focus on Cetrotide, okay? And then, so during your cycle, you're usually doing shots for about 10 to 12 days. And the first part of the cycle, you're really gonna be focused just on these two medications or one or the other, and call these the gonadotropins. And you'll be using your gonadotropin that's prescribed to you for the duration of the cycle, so the 10 to 12 days that you need. But you may be changing dose, adjusting dose, and so please refer to the instructions that your provider gives you at your visit or after your visit, so that you're doing the right dosing. And then again, in the middle of the cycle, you'll be adding either the Cetrotide or the Ganirelix. And then once you get to a point where your follicles are ready to move forward with retrieval, we do need to do one final injection to help you mature the eggs. And so that's usually called the trigger shot, okay? So triggering of ovulation, basically. And there's many different formulations and different types of trigger shots, which I will cover in a separate video, just because it can be a little bit confusing depending on what you individually need. So I didn't want to talk about all of it in this video, but just know that there are different kinds. I'm gonna go over the general categories so you kind of are familiar with it. And I'm going to go over kind of how to store them, but look for the other video to learn how to do those injections, okay? And so the categories will depend, which one is for you depends on your body and your protocol and where your ovarian status is, and your doctor will decide that. And so Ovidrel is a very common one. Here's a box that looks like Ovidrel, and this is a single-use injection, pre-filled, very easy. There's also something called Novarel, and I don't have a box for the other kind of equivalent called Pregnyl, but that's also a common one. And these are HCG hormones. And so Ovidrel is recombinant HCG hormone, and then you have these which are purified HCG hormone, which are all used to trigger ovulation. And then you may have heard of something called the Lupron HCG trigger, which is a combination of Lupron, medical name is Lupron, and a combination of a low dose HCG. So that's another type of trigger you might be using. And then sometimes we also use what's called a pure Lupron trigger, where you're only getting Lupron or Lupron. So depending on your particular situation, you'll be prescribed the trigger that is most suited for you. And again, I'll cover that in a different video, and certainly there will be videos for those medications on Freedom MedTeach as well. Okay, so in terms of storage, let's talk about storage. Well, Menopur can be stored at room temperature, but please, obviously anything that's okay to store at room temperature, you will want to keep out of direct sunlight. You will also want to keep it somewhere cool and dry. You do not want to leave it in your car, for example, because anytime things overheat, then you'll lose the potency of the medication. So please, when you get it from the pharmacy, keep it in a cool, dry place. And Menopur is single use. Each vial has 75 international units, and I'll cover that a little bit more later in the video. So it can always be stored just at room temperature. Gonal-F can also be stored at room temperature, but once you open it, and you have mixed it, you will want to keep this in the refrigerator. So this Gonal-F box comes, it says 450, but it usually comes with overfill, which means you'll get some extra medication in there, maybe up to 600 international units, IU, or units for short. So you don't want to waste any of this medication and only get one injection out of it, because most people, common dose for Gonal-F is anywhere between 150 to 300, 375. So usually you could get multiple injections out of one vial, so you'll want to keep that in the refrigerator. Once you open it, it's good for 28 days. For the pens, Gonal-F Pen and Follistim Pen, same thing, keep it in the refrigerator because these are already pre-mixed, and once you open it, you definitely want to keep it in the refrigerator, and it's also good for 28 days. Cetrotide, when you get that home, you will want to keep it in the refrigerator as well. It needs to stay cool, and you don't want to obviously leave it in sunlight or anything like that, and anywhere warm. You want to keep it cool. Now, the other medications, the Menopur and the Gonal-F, are usually done in the evening, so you're never going to have to carry that with you anywhere. This medication is done during the day, usually in our protocol. And so it may be that you may have to bring it with you to your appointment or to your office. So it is okay to keep this out for a few hours in, again, keeping it cool room temperature conditions. So in your purse, it's fine. For a few hours, 2 to 3 hours, it's not going to go bad in that short period of time. But any chance that you get, you should keep it cool, and make sure that it stays potent, because this is very important medication. And Ganirelix is different. It can be stored at room temperature. I have no idea why the difference. They're essentially the same medication, but for Ganirelix, it's approved by the FDA to keep it at room temperature. So it's fine to keep this at room temperature. Ovidrel needs to be refrigerated. Okay, so as soon as when you get your prescriptions, check if you have Ovidrel prescribed, keep it in the refrigerator so that it stays potent for when you need it. Lupron or Lupron HCG products are usually compounded, so that means that they've been opened and they've been mixed already. So you definitely want to keep those in the refrigerator so they stay potent. Look at expiration dates. Those don't last as long. The rest of the medications have longer expiration dates, but that one is not good for as long. So if you had a cancel cycle from the month before and had Lupron HCG that you have extra, hopefully you don't have a cancel cycle, but occasionally that happens. And so if you have extra meds, you definitely want to check the expiration date before you start to use it again. Anything like the HCG, Novarel, as well as Pregnyl, these are powder form that have to be mixed, so these can be kept at room temperature as well safely, okay? So if you get that, you can keep it safely. Also, sometimes I have patients who are prescribed other medications that are add-ons, such as growth hormone. That one also has to be refrigerated. So just go ahead once it's been mixed, I would say. So I would say a good rule of thumb is that once something is either in liquid form or has, once it's been mixed, you should just keep it in the refrigerator. If you're not sure, again, you could look on Freedom MedTeach. They do have that information, and Google the website or call us. But I think it's never bad. If you're not sure, just put it in the refrigerator. Medication's not going to go bad if it gets cool. You definitely don't want it to form icicles or freeze, so you do want to be mindful that your refrigerator isn't set to too cold a setting, because I have had that happen in my house where it gets cold and then you're forming icicles, and that wouldn't be good. But just in the normal kind of refrigerator temperature, it would be fine if you're just not sure. But again, you can always double check with us, okay? And so that's basically how you store the medications and kind of your pre-prep before you get started. And then in this next portion of the video, I'm going to go ahead and cover how to do your injections. So now let's go over how to mix your medications. We will start with Menopur and Gonal-F, which are the medications you'll be starting with first, okay? So basically, before you start your injections and mixing them, I always tell my patients to get everything ready. So you'll want to make sure that you have your sharps container close by so you can dispose of any needles. You want to make sure that you have alcohol swabs. You also want to make sure that you have any of the syringes and needles that the clinic or the pharmacy gave you, so that you can have them ready there and available to use, okay? So let's go ahead and start with the Menopur. So Menopur, again, comes in this green box, and of course this box is open, but you want to make sure yours is sealed, and the most importantly is you want to make sure the vials are sealed. So typically you're going to get Menopur, which is the medication itself, is in powder form in these little vials with a peach top, and then you're going to get saline, which is the salt water that you will use to mix up the powder, okay? And sometimes you're going to get a full box, and sometimes you might get these in loose form, because if you only need one or two, then you're not going to get the full box, but you'll want to make sure you know that the peach top are your actual medication. So let me kind of show you a little bit closer what they look like. So the Menopur looks like this. You'll see peach top and the green writing, and each of these bottles has, you'll see it says there are 75 IU, which means that it has 75 units of the medication in there. So please look on your protocol. If it says 75 IUs or 75 units, then you need one vial of powder. If you're someone who needs 150 units, then you're gonna have 2 vials of powder, okay? And then so on and so forth. If you need 225, that means that you would pull out 3 vials, okay? So everybody's dose is different, so please look on your particular treatment calendar to confirm your dose before you start mixing the medications. Once you mix the Menopur, it is good for about 30 minutes. So you really want to kind of mix this right before you're ready to use it. You don't want to leave it out for too long. And I'm going to go ahead and also tell you the other tools that you need to draw up the Menopur. So you will have been given usually a syringe as well as a needle. It comes like this. Let me open it. So typically we're giving you a syringe that can hold, anywhere between 2 to 3 ml. 3 ml is the most common. It'll come with already a needle, and this is quite a large needle. It's mostly just to draw up the medication. You do not want to use this to inject yourself. You will have been given in these little packages smaller needles, and so if you look at the package, it will say 27G, which is 27 gauge, which means it's a small needle. I'm going to show it to you just so you can see how little that is. And I'm going to uncap it carefully and show you, see how little the needle is. So this will definitely be more comfortable to inject with, okay? So you'll want to make sure that that's ready as well. And obviously this is an open package because I'm demoing. And so what you want to do is, I always tell everybody to pop the lid off first. So I pop the lid off everything. So here's my saline. You could just set that down and pop open my Menopur. So you will see that this is my Menopur. Once you pop the lid off, you see how it has the little rubber stop area, and that's where you want to put the needle in. So what I do first, I set these down on my table, and then I take my needle. I also have my alcohol swab. So what I'm going to do first is I'm going to clean the top of the vial of the saline, because I need to draw up the saline first. And I'll usually just go ahead and clean my Menopur as well, because I know that I'm going to be using it shortly. So I'm going to go ahead and sterilize that, okay? You want to make sure that anytime before you put a needle into anything, just clean it with alcohol swab. It will never be the wrong decision. Always clean, 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 okay? So I would take this needle, and you only need about 1 ml of the fluid. It comes with 2 ml, so you really only need half of the bottle, because we don't want you to have to inject too much volume, but just enough to kind of dissolve the powder. And so what you'll do is you'll take this needle, you kind of see if the angle I can show you. So you want to put your needle in carefully and just give it a nice push. And then what you will see is, see how I'm keeping my needle right in the fluid? You don't want to put it all the way to the top where you're getting a lot of air, okay? So you're going to start pulling, and then you'll just look at your mark to the point where it says 1 ml. And as you're pulling initially, you're going to feel a little bit of resistance, and that's okay. Just kind of keep pulling, keep that resistance, and then you're done. Sometimes when you're doing that, you might, if it's your first time, you might end up getting some air in the top, and I didn't, but let's say you had like this much air in there. See how that's air? That's not a problem, don't worry. You just kind of gently push it all the way through, and then the air is gone, okay? And then so now you have your saline ready. And just know if you're off by just a teeny bit on the volume, that's okay. That doesn't have to be that precise, but just close to the 1 ml is good, because you're just really interested in dissolving the powder, and that will be more than enough. So then you take your first vial of the powder, and you can see here, see the white? That's the powder, okay? And so what you want to do is you just want to take it. I've already cleaned it before, remember? If you can't remember, clean it again. So then you just put the needle in, and there'll be a little bit of suction. And so sometimes, see how I'm just pushing the fluid in? Okay, and then you just want to make sure, see how that dissolved really quickly? So you just inject your fluid in there. And then you want to take a look at it, turn it towards yourself like I'm doing. And if there's any powder that looks like it's not dissolved, you really could just gently swirl it like this. Okay, you don't want to shake it because you don't want there to be any bubbles. And sometimes, one little thing that I always tell people is like there's suction in these bottles, a little bit of vacuum. So even when you just put the needle in, sometimes it'll suck out a drop or two of fluid, and that may be enough to dissolve your powder. And so it seems like, oh my gosh, was there powder in there or not? Is it empty? It's probably just because the few drops you had already dissolved it. So basically you have it like this. So now you want to pull this out. If this is your injection, then obviously you're only doing 75 units. You want to take this out. So again, always want to turn the bottle over. Make sure the needle is within the fluid, not in the air all the way up. You don't want to draw up a bunch of air. And then just pull it. Kind of pull back on your syringe, kind of like how I'm doing. Just pull it, pull it, pull it. And with this, I usually end up getting a little bit of air because I just want to make sure I get every little drop. And to get every little drop, sometimes you're just going to get some air. So take that out. And remember I showed you there's a little bit of air. And then you can just pull that, kind of push the syringe gently. You don't want to shoot out all the medication and waste it because the medication is costly, so you want to be really careful with it. But you could just push it all the way to the top so that it's just all fluid, okay? Now, if this is all you need, then at that point you're done. And you would just want to carefully put the cap back. A lot of times I'll have people just put the cap on the table and then put the needle in to just try to hook it on first and then cap it. And I can show you that a little bit later, how I do that. But if this is all the dose that you need, then you would be switching your needle at this point. Your syringe will allow that needle to be twisted off, and then you want to kind of keep the syringe upright, and you take your smaller needle and just twist it on. Make sure that it's twisted on well, because what you don't want to happen is you go to push the syringe. If the needle is not on tightly, then the whole thing just pops off and then you'll lose all your medications. You have to start over. However, let's just assume that you are someone who needs 2 vials of the powder because you need 150 units. So then you would just keep this needle on. Now this already has the fluid from the first vial you mix. So then you would just take your second vial, and I'm going to show you here, second vial of powder. Put that in, and it just dissolves really quickly. I wish I could have showed you like exactly how fast. And you just want to push the whole thing in, and then again you could gently swirl it. Okay, gently swirl it, and then turn it upside down again, just like we've been doing, and then just pull out all your medication, all the liquid, every last drop if you can. Sometimes you're going to have a tiny little drop left in, and that's okay. The manufacturers kind of accounts for that. You're going to lose maybe a little bit in the bottle, okay? But try to get as much as you can, even if you're pulling out air. All right, so now that that's all done, again, get rid of your air. Sometimes you might squirt out a little bit at the top, and that's okay. Just a little bit is okay. Okay, and then when you tap it like that, you always see it in the movies. It's because that'll make the air bubbles go to the top too and make it easier for you to get all the air out. So then again, carefully recap your needle, and then you want to take it off. I'm having a little trouble there. Remember to twist, and then you take the smaller needle and then twist it on, and that's it. Okay, and now that medication is ready for you to inject. And my little tip about Menopur is that it can be a little bit acidic. So when you first mix it, and if you were to inject it really quickly right at that second, sometimes it can burn a little bit. But if you let it sit for about 30 seconds to a minute or so, that will help, and it may not burn as much. But typically Menopur will be the one that burns a little bit more because it has a little bit more volume, and because of that property that it has. So I have been teaching everybody to just mix the Menopur first and just let it sit while you prep your other meds, and that gives it a natural little break to be able to make that maybe a little bit better when you're doing the injection. Okay, so that needle that you finished with, throw it in your sharps container. Okay, and then you're done with it. The vials can be disposed of in regular trash because they're not sharps, so you're okay. So any needle you go ahead and put in to your sharps container. Okay, so that's your Menopur, and then you put the rest of it away. And the next thing you want to do, because you're usually going to be starting with Gonal-F and Menopur, then you're going to take out your Gonal-F. And obviously this is a demo box, so it was already open, but you want to make sure that this seal is not broken. That's one sign to make sure that it's, you know, a brand new box. And then usually when you get your box, it's going to have this plastic seal on it. You want to make sure that that's sealed as well. And in your box, you're going to get powder, a syringe with fluid in it, and then you're going to get all these special needles. Okay, and I'm going to tell you about that. So here's a look at the Gonal-F. This medication in this vial, all the powder in this vial, it says it's supposed to be 450 IUs, but the manufacturer usually gives you some overfill, just some extra. So that means that typically we can get about 600 units or IUs of the Gonal-F out of this one bottle, which is great. It's extra medication. So the goal is to use up every drop of it you can before you open another box. So, you know, it's great to know that we have some extra. This is the pre-filled Gonal-F syringe. And this is great because you don't have to draw up anything. It's already ready. And I'll show you how to mix that just shortly. And then before I do that though, I do want to show you the special needle that the Gonal-F comes with. So usually when you get a syringe and a needle, it's usually by volume. So it has markings on it that tells you, you know, that, for example, on that 3 ml syringe, it had a 0.5 ml marking, 1 ml, 1.5, and 2 ml. Well, this needle is special because the markings on it, I don't know if you can see that. Here you go, you can see 150, 225, there's a 75 up there. 75, 150, 225, 300, it's actually matching to the amount of units you'll be using. So again, look on your protocol or your treatment calendar, and it's going to tell you how much Gonal-F you need. It may be 75, it could be all the way up to 375, so it just depends on your protocol. A pretty common dose is somewhere between 150 to 300 when you're doing an IVF cycle, but that's what the marking is. You do not want to use this needle to draw up your Menopur. I've had patients get confused about that. So please do not do that. Yes, the Menopur is 75 units, but you want to remember that the full vial of powder, one vial gives you 75 units. So when you mix it with that 1 ml of fluid, you have to take up the whole 1 ml, all of the liquid, to give you the 75 units. I unfortunately have had patients use this needle to draw up the Menopur and go, oh, I'm giving myself 75 units. And they give themselves this amount, and then they have a whole bottle still left here. That means that they're only getting a tiny part of the 75 units they actually need. So that would not be ideal. So please remember to only use this needle for your Gonal-F, okay? So that's really, really important. So we can open that, set that aside, and then I'm going to teach you how to mix your Gonal-F. So what you're going to do is you're going to take this Gonal-F vial, pop it off, and then just clean it. Okay, clean, clean, clean. And then you're going to take this, pull it open. You'll see that it might drip a little bit, no big deal. Take your powder and then just put the whole thing, and then again, you want to just inject the whole thing in. It goes in a little bit slower because it's a really fine needle, so you just kind of want to shoot that in there. And there it goes. It's mixing up, okay? And that's it, all right? And so this can also dissolve a little quickly, but not as fast as the Menopur, but it can dissolve pretty quickly too. So you see I didn't even swirl it and it's already clear. So you could just take this needle out and then you're gonna be done with that. Don't try to recap it, just throw it in your sharps container and then you're done. And then if you see anything, I always inspect it, make sure there's no powder sticking on the side wall. So if it looks like there was a little bit there, I just kind of swirl it a little bit like this and then I'm done. Do not shake, okay, because you'll create bubbles. So then with that, if you're ready, let's say you're gonna be doing 150. So same thing, certainly could clean it again because you're poking it with a needle again. So I always say, clean it, clean it, clean it. Take this, inject it in. And you're not gonna be able to see, this needle is really tiny, so you won't see the needle in the fluid, but it'll be in the rubber plunger. And so then you just wanna draw it up to what you need it. And I need 150 for this protocol. So I'm just drawing it. You see how I'm drawing it to 150? You wanna make sure that stopper is right at the 150 mark, okay? If I wanted 225, I just draw a little bit more, okay? And that's it. Then you're done. And this remaining amount here, you want to go ahead and make sure you put it in the refrigerator, okay? So if you still have more to prep, then you can cap it and leave it. And I always think it's a good idea to kind of get the cap, even if it's not firmly on, is to protect the needle so it doesn't get dirty while you're waiting. You know, you might do your Menopur first. So anyways, here is your Gonal-F and it's ready, and you can set that next to your Menopur. Now, a couple of little important tips about this Gonal-F. So let's say you have a little bit remaining in this vial, but you can't remember or you're not sure how much is still in there. Or maybe you did 300 units and you know that you should have 300 units in there because we think it's 600. But you go to draw it the second day for your second injection and you went to draw up 300 and you only got 225 out of it and you're missing 75 and you're like, well, I thought I should have total 300. Well, sometimes the overfill is not perfect, so it may not be exactly 600 in there. So all you would do is go ahead and draw up what's remaining of this bottle, and then you would open a whole new box and mix it just like I showed you, and then that one now should have somewhere between 450 to 600 units, right? And then you would just take the syringe that you have that you drew up the 225 in and then draw up the 75 that you need to make a total of 300, and then you'll be set, and then leave that one in the refrigerator for the next day. So you really want to get the most out of your Gonal-F that you can, because as you know, fertility medications can be very costly, so we do want to maximize everything that we've got, okay? So now you've got your Gonal-F and your Menopur ready. And usually you're going to be doing your first injections in the evening, and typically people are doing their shots between 6 to 9 p.m. at night, usually when they get home from work or their day. What you want to remember is that these medications are potent or effective for about a 24-hour period, so you really don't want to go outside of your 24-hour window from the last time you injected it. So let's say you took it at 7 p.m. the night before, then you want to do it around 7 p.m. the next night. Now between probably 6 to 8 is fine. You could do it a little bit before, and you certainly could do it a little bit after, but you don't want to go, you know, too much further than that, and you certainly don't want to you know, miss a 24-hour dose. That would be really, really bad. But I have had patients call me, you know, Dr. Chuan, I didn't do my injection at my usual time. I'm usually doing it at, you know, 7 p.m. and I did it at 8:30. I think that's okay. You're, you know, within that kind of window of time where I think it's acceptable, and I don't want anybody to panic, but I definitely don't want it to become a habit where you're missing doses or skipping doses or being late all the time. So try to be as consistent as possible. Set an alarm that will help you. It always helps me remember. And pick a time in the day that usually it's not going to be a problem for you. So even though we say it's 6 to 9 p.m. is usually when my patients do it, I do have patients that work evenings and may not get home, you know, till 9. Is 9:30 okay? Yes, absolutely. But just try to be consistent with your time, okay? So the Gonal-F and the Menopur are going to be used in the evenings. Between 6 to 9, and again, remember, every 24 hours is when the medication is effective, okay? So the next thing that you want to do is you want to prepare your injection site. And so first it's figuring out, where am I going to inject myself? So I always tell everybody to find the area right next to your belly button. That's where most of us have some extra flesh. Even if you're really skinny, you're going to have a little area that you can pinch. And so I always tell people to kind of pinch kind of that area, that skin next to their abdomen, okay? Next to their belly button on their abdomen, I should say. And so that's the best area. It doesn't have to be the same exact spot every night. You want to kind of rotate, because there's a strip of, you know, skin and flesh there that you can inject in. And really, it doesn't matter if it's a little bit to the left, a little bit to the right, just kind of go right in that general area. And you will notice that when you do some injections, you might get some bruising. So it's actually good to kind of rotate the area so you're not going into a bruised area. Not that it's going to, you know, hurt anything, but it might just feel a little bit more uncomfortable. So definitely kind of identify that area, and then you just kind of want to pinch it. And if this, let's just say this was your abdomen, you can kind of pull the skin back. It's a little hard with this, but you kind of want to pinch it like this, okay? So that it's a little taut, but then you're pinching the skin and making that little pinch of a roll almost. And so with that, what you want to do is, if this is your skin, you want to clean it with an alcohol swab, like I said, before you inject. Another little tip that I have for patients is that if you're nervous about that first injection or feeling that little prick, go ahead and ice the area. Get a little ice cube and kind of keep it on there for like 10-15 seconds. Ice is really good at numbing the skin. And then what you would do after you ice it, you gotta clean it. And that might feel really, really cold, but you know, honestly, it actually can be helpful in minimizing that sensation of the prick. And so then what you would do is you would take your first injection, right? And let's say this is the Gonal-F, okay? And then you want to just kind of hold it and squeeze it, and then go straight in and push, and that's it, okay? And you're done. And then throw that directly into your sharps container. You don't need that anymore, okay? So now, once you inject it, you can release the area, because you got to open your next injection and get that ready. And so one thing I always tell patients is please don't hesitate, because sometimes you get nervous and so you're kind of tentatively trying to go into the skin and not poking it. And if anything, that I think it brings on more anxiety, and I totally get it. Doing a shot on yourself is something that none of us ever imagined doing, so it's a daunting thought. But I think that if you can actually just go forth and be direct with it and just poke and do it, you will realize that it's actually very minimal amount of a prick, and then the next day you're like, okay, this is a little better, I'm getting used to it. But don't hesitate. If you hesitate, it might end up being a little bit more uncomfortable, so just go for it. Okay, so now this is your Menopur, and you want to uncap it, right? And usually, let me just show you, before I uncap it, I always double check, make sure my needle's on well. And so this is on really tightly, and so it's good. The Gonal-F, the needle is attached, so you don't have to worry about it. But this, whenever you have to switch needles, I'm always really careful when I go do the injection. So again, you want to get your alcohol, right? Clean your area, always clean your area. If you want to do ice again in between, totally fine too. Just make sure you clean it after. Pinch your skin, put the needle all the way in, and off you go. Okay, so this is a little bit more fluid, and this is obviously not your flesh, so I'm not going to keep pushing all the way through, but you understand what I'm saying. So that's your Gonal-F, and your Menopur, and then you're done for that evening. So for the first part of your IVF cycle, you're usually just going to be doing the Gonal-F and the Menopur, and then obviously mid-cycle you will be adding some additional medications. Now we're going to learn how to use Cetrotide, which is a medication we use to prevent premature ovulation. Usually you'll be starting this medication towards the middle of your cycle, once the follicles have gotten large enough that we worry about them prematurely releasing the egg. And so that's usually anywhere between day 5 to day 8, depending on how fast your cycle is going. So your provider will give you instructions on when you should be starting this. This is a medication that needs to be refrigerated. And it can stay in room temperature for a few hours, but typically you want to keep it refrigerated. That's very important. And you want to make sure that you're doing this at the same time every day. So it's good for 24 hours, and you want to try to do it within 15 to 30 minutes of when you did it previously. So if you did it at 10 o'clock in the morning, so typically here we instruct patients to do it in the morning. So if it's 10 a.m. that you did it the day before, then you want to try to do it, right at 10, but no later than 10:30. You certainly could do it a little bit earlier, so you could do it at 9:30, half an hour before. That's fine. I always give that analogy. It's like a car. You don't want it to run out of gasoline, so you can always top off the tank before it runs out, but you don't want to go past that point. So this is the same thing, okay? You want to be really, really good about that. Set an alarm if you need to. On your first day, because we may be giving you the instruction to start it right after your visit, and your visit might not be till 11:30, or sometimes even noon if you're having a late appointment. And so you might do your first shot at around 11:30 or noon the first day. It's okay if you want to move that up a bit so that the next day you're doing it around 10:30, and then just staying on that schedule. So for that adjustment for convenience, but you want to stay within that 24-hour zone as much as you can, okay? So now let's go ahead and teach you how to use this. So when you open up the Cetrotide, again, this is a demo pack, so it's already open, but you want to open it. It'll come in this package that looks like this, okay? And within it, when you open it, and this should be sealed, what you're gonna see is you're gonna see a pre-filled syringe with fluid already in it. You're gonna see another bottle of powder with a blue top on it, just like with other medications. Usually it's powder form to mix with fluid. And then it's gonna come with 2 different syringes. The yellow one is a larger one to draw up the medication with, and then the smaller needle in the gray cap is the one that you want to inject with. So remember that. So let me go ahead and show you how to do this. So you want to just go ahead and take out your powder, take out your syringe, and again, you want to make sure you have an alcohol swab to clean this bottle, okay? Obviously pop it off first and then clean it, and then you want to set that down on your table, and then you want to prepare the syringe and the needle. So this just pops off like this, and then you want to uncap this. It comes off easily for me because the sticker has been broken before, but you may find that you have to twist kind of hard to get that first cap off because of the sticker. Again, screw that on really tightly to make sure that you don't accidentally lose the needle. Uncap it. And then what you want to do is you take your Cetrotide powder. You see how it's a powder form, and just like everything else that you see, you just want to kind of just put that into the needle. And this one's a little bit harder to push the fluid in, so you might have to push a little harder, okay? And it'll start to dissolve. You'll see it here. This one's a little bit stickier. Sometimes the powder gets stuck on the side, so just kind of gently swirl it and keep pushing your fluid in. All right. And if you need to, like this right now, it's still a little sticky and there's powder on the side, so I just gently swirl it to dissolve it, okay? And so you just want to make sure the whole thing is dissolved before you draw it up to inject, okay? So swirl, swirl, swirl. It may be that this is a demo pack, so it may have been sitting around a little bit longer, so I think it's taking a little bit for the powder to dissolve. But so I'm just gently swirling that. Hopefully you're usually I feel like the actual medication that you get is not going to take this long to dissolve. And so it's dissolved, and so just like I taught you before, you're going to go ahead and turn it over and draw that fluid back into the bottle. From the bottle into the syringe, I'm sorry. And you want to get all of it as much as possible. Right now, I'm stuck with the situation where I think I got some air in it earlier and I got a bunch of air in here. So what you want to do is you just want to push that back up into the bottle. You can push the air because the syringe will only go back so far, right? So if you have too much air in it, you won't be able to get the whole content out. And that's where I was struggling with. So even someone who's been doing this a long time like me can get into trouble. So you want to just kind of tilt your bottle all the way in and get every single drop that you can, okay? And again, if you get a little bit of air, it's okay. I think I was tilting the bottle a little bit too much before. All right, so that's everything. I got every single drop. Okay, so got some air in there. I'm gonna get rid of it. And if you do have a little tiny bit of air, it's not going to be harmful. If you just can't get it out, that's okay, because a little bit of air is okay. You're not injecting into a vein or into an artery, so a little bit of air is into the skin. It's totally tolerable. Just a tiny little drop, you're going to see that sometimes, okay? So I don't want you to be nervous about that. So then once you have all of your medication, you will have to, unfortunately, cap this back on, twist this off, and you're going to get rid of this needle. Put it into your sharps container, and then you're going to want to switch to your little needle for your injection. Okay, so then now that's ready to be injected, and then of course you will want to, you can set that down and prepare your injection site by cleaning and wiping, and then you will get your needle ready, and you want to pull back the skin and keep it taut, but squeeze the flesh, and then go all the way in and inject, okay? And then you're done with the Cetrotide. So that concludes the injection instruction portion of our video. So I've gone over how to use the Gonal-F multi-dose medication. I've gone over how to use Menopur, and we've gone over how to use Cetrotide. If any of the information is unclear, please reach out to us so that we can clarify further for you. And then a couple of tips about what to expect during your IVF cycle. I often get questions on, is it normal for me to have bruising at my injection sites? Yes, unfortunately, you can break little capillary vessels and get bruises. Is it normal for me to get little welts? Sometimes some people have very sensitive skin, so am I welt up after the injection? That can certainly be normal as well, especially if you have sensitive skin. If you do notice a rash that persists, it's okay to use a little bit of hydrocortisone cream topically just to help with that rash if there's some irritation. I find that Menopur, sometimes we talked about it burning a little bit, and that may irritate some sensitive skin. So a little bit of hydrocortisone can help with that. And also I have patients ask me, is it normal for me to feel bloated? Absolutely. I think that in the beginning part of your cycle, you may or may not feel a lot because the ovaries are just starting to develop, and not everybody feels their ovaries the same way. Some people's ovaries are much more sensitive and they feel everything, just like around the time of ovulation. Some people can feel that, and then lots of us never ever notice when we're ovulating. So our bodies are all different, so you may feel differently. It's not abnormal if you don't feel anything, but it's also not abnormal if you do feel something. And the beginning parts, I would say that first 4 to 6 day period, you may not feel very much at all because your ovaries are just starting to respond to the medication. And then as your ovaries become more enlarged because the follicles are growing, that's a good thing, but you will feel more bloating, and that's completely normal. And you're gonna feel kind of full. Sometimes you feel more bloated because actually the hormone levels rising with the growth of the follicles will lead to some constipation for certain women. And so that is a normal change that your body can go through when the hormone levels are rising, but it can make you feel more bloated because when your bowels slow down, you can collect more gas, and that'll contribute to that bloating sensation as well. So you want to be really good about walking. Gravity helps to keep the bowels moving. You want to make sure you hydrate really well. Make sure you are eating a balanced diet with fruits and vegetables. And if you're still feeling uncomfortable, then certainly you can add some over-the-counter medication such as Colace, which is a stool softener, or Senna, which is a bowel motility agent that kind of stimulates the bowels, and you can get this all at the pharmacy. There's a combination medication called Colace, which includes the Colace, the stool softener component, as well as the Senna, so that the two can work in combination together to kind of keep things moving along smoothly. We'll give you a packet of that at the surgery center after your surgery, because it's such a common problem that we usually give patients some just to start with after their retrieval. It's very difficult to catch up with constipation, so it's something that you want to monitor and stay ahead of so that it doesn't contribute to more discomfort after your retrieval, because your ovaries will still be enlarged and will take time to shrink down, and constipation just makes it all worse. The other common symptoms that patients might feel may include, I think, symptoms related to estrogen levels fluctuating and rising. So that may include feeling a little bit more fatigued, feeling a little bit more emotional, snapping a little easier or crying a little bit easier, and that's all normal. And you're also going through a very emotional process. Going through in vitro fertilization is, a big commitment, and it takes a lot of time and physical energy and emotional investment. So it's natural for patients to feel more anxiety and to feel more emotional anyways. And then on top of that, we're amplifying that because the hormone levels will accentuate that. So feeling like, emotional, fatigued is all more common. Other things, patients might get some breast tenderness, occasionally towards the last, I would say, 2 to 4 days. If your hormone levels are getting pretty high and you're very sensitive, you might feel a little bit nauseous. It's not as common, but definitely can happen. Occasionally patients complain about some headaches, or if you're someone prone to migraines, the hormone levels might trigger that. But in general, once you go through your retrieval, your hormone levels are going to drop down, and what you will feel residual are kind of bloating symptoms, but a lot of these high hormone level symptoms will start to go away. And typically you're going to get your period about 10 to 14 days after your egg retrieval, and by that point I would say my patients are usually completely back to their normal selves. And I would say the first 2 to 3 days after the retrieval, are, if you're feeling constipated or feeling bloated, those are kind of when you're feeling that the most. And we certainly will give you pain medications, constipation medications, whatever you need to make you feel more comfortable. And again, everybody's different. Some people feel a little bit more and some people don't feel very much. Also may depend on, the response of your ovaries. People who, collect more, we can retrieve more eggs from, and whose ovaries are getting bigger, and because of more follicles, might feel some of these symptoms more intensely. But in the end, I think that just know that everything will go back to normal. This is a finite amount of time, so hang in there, and we're here for you if you have any questions or concerns. I'm also going to include a commonly asked questions, if I can, on the link below, so that if you guys have any questions, you can also take a look. And usually the staff is really, really good about answering these types of questions. Just so know that if you have any concerns, we're here for you. So hopefully this video helped you on this preparation for doing your injections, and hopefully helped you feel more comfortable and confident with the whole process and the idea of giving yourself an injection. And I would say that if you need help in the beginning, if you have a friend or a partner or family member, anybody can learn to help you with the injections if you're feeling uncomfortable. And usually though, I would say within a couple of days, most of my patients, even those who've had needle phobia in the past, have done really well with it, and have told me, it's not as bad as I imagine it to be. So hopefully that will be the same for you, and that everything will go smoothly. And I wish you the best of luck on your upcoming cycle.